Dear colleagues, I'm Christoph Diener from the University of Duisburg-Essen in Germany, and I would like to report 6 different studies which were published in December 2023. I would like to start with the topic COVID-19. And there is an interesting question whether COVID-19 vaccination prevents post or long COVID syndrome. And this question was addressed in a population-based study in Sweden, published in the British Medical Journal, with 590,000 participants. Half of them were vaccinated and had COVID-19 infection, and the other one were not vaccinated and had the infection. And the incidence of post-COVID and long-term COVID-19 in the vaccinated group was 0.4%, in the non-vaccinated group 1.4%. And this is a strong indication that COVID-19 vaccination can prevent post and long COVID syndrome. My next study is on migraine and was published in The Lancet. About 40% of all migraine patients have a prodromal phase with many, many different symptoms and followed by the typical migraine attack. And this study investigated whether an antagonist at the CGRP receptor, ubrogepant, can prevent the migraine headache when given during the prodromal phase. And this was a crossover study in 518 people with migraine who had prodromes. And what it showed, that the primary endpoint, which was moderate or severe headaches within 24 hours, was 46% on ubrogepant versus 29% on placebo. And this is a strong indicator that possibly using an effective migraine treatment during the prodromal phase can prevent headache following the prodromal phase. The next study is from everyday clinical practice and published in Neurology. The authors wanted to find out how effective are different migraine therapies for the treatment of acute migraine attacks in clinical practice. And they analyzed data from a migraine app from 270,000 migraine patients. And they used ibuprofen as a reference. It showed that for the endpoint, the treatment was helpful. By far, the most effective treatment was alithriptan with 80%, followed by solmitriptan and sumatriptan. The least effective were aspirin, ibuprofen, and paracetamol, which was, for example, helpful only for 38%. This is a very interesting observation because alithriptan practically is not used. And one of the reasons is it was never marketed. Now, in the meantime, it is out of patent and it is cheap, and it clearly shows that triptans are the most effective therapies for acute migraine attacks, but they are underused. My next study deals with the concept of ESUS, embolic stroke of undetermined source. We had 2 randomized trials, Navigate ESUS and Respect ESUS, which investigated whether rivaroxaban or dabigatran are superior to aspirin in the prevention of recurrent stroke in people with ESUS, and both studies were neutral. Now, the third study, Atticus, was published in the journal New England Journal of Medicine Evidence. And this was a study which compared apixaban twice daily 5 milligrams with aspirin 100 milligram in a high-risk population, and all of these patients had implanted ECG monitors. And the primary endpoint was apparent or silent strokes on MRI. After 12 months, there was no difference in the primary endpoint, and there was also no difference in major bleeding. There was a subgroup analysis which showed a trend towards that perhaps there is efficacy in patients older than 75 years, which was also found in the Respect ESUS study. Now, this deserves, I think, a meta-analysis from all of these studies. My next study deals with a new class of drugs, the so-called coagulation factor 11 inhibitors. Now, people who have an inherited deficit or deficiency of factor 11, they have a decreased risk of stroke and myocardial infarction and almost no increased risk of major bleeding. And therefore, small molecules were developed which block the coagulation factor 11A, and one of them is milvexian. Now, this drug was investigated in a dose-finding study in Lancet Neurology and compared with placebo. And what it showed, there was basically no difference between dual antiplatelet therapy as monotherapy and the combination with milvexian on recurrent stroke, and also not on silent strokes on MRI, and there was no major difference in bleeding complications. Now, whether this new treatment approach is really effective has to be shown in a larger phase 3 trial. And my last study is from China and was published in the New England Journal of Medicine. This study investigated dual antiplatelet therapy, clopidogrel plus aspirin, compared to aspirin monotherapy in people who had a high-risk TIA or ischemic stroke with an inclusion time of 72 hours, and the patients were treated for 90 days. There was a lower risk of ischemic events for the combination group with a benefit of about 20%, but an increase in moderate or severe bleedings. And you ask yourself, with the available studies we have, which clearly showed that combination therapy is only superior to monotherapy for the first 2 weeks, because then the increased bleeding risk kicks in, while this study again was done over a period of 90 days. I think standard of care should be dual antiplatelet therapy, clopidogrel and aspirin, for about 10 to 14 days. Dear colleagues, I'm Christoph Diener. I'm from the University of Duisburg-Essen in Germany, and thank you very much for watching and listening, and a good new year 2024.